So the nurse is preparing an educational session for Mrs. Porter on CHF management in the home. Which of the items should the nurse include in the teaching? Select all that apply. So the best way to answer any select all that apply is to know that every choice could be right and every choice could be wrong. So let's look at them one at a time and give it a yes or a no. Is this a good thing or not a good thing? So that's what we want to know. What are we going to teach the patient? All right, the first one, daily weight monitoring using the same scale at the same time each day. Yep, that's a plus. That's a plus one. We definitely want to do that. The same scale and the same time of day are important. And another thing that's important is making sure that your pockets are empty or you have the same things in your pockets, because that can change the weight as well. So that would be definitely one. We would select that one. Next, we have, she needs to be able to recognize signs of worsening CHF, such as increased shortness of breath or swelling. So yeah, that's another good one. We definitely want to include that because she needs to know when to call the doctor. She may have waited too long with this last call. All right, here's another one. We need to teach her to skip prescribed diuretics if her weight is stable. What do you think about that one? Should she skip meds? No, people should not skip meds even if they are stable. They should not do that without calling a provider. If they think they should skip a med, they should be calling the office, not just sitting there and making that decision on their own. And again, like I said, there's so many Americans out there doing their own thing. This is going to be a little tricky, but that would be a no. We would definitely want to say no, do not pick that answer.